Good evening, welcome to Left, Right and Centre. I'm Vishnu Shom. 1 month after the banker Uday Kotak wrote to Prime Minister Modi as President of the Confederation of Indian Industry that private sector has still not been involved in COVID vaccinations across India, we actually have details of not just his letter to the Prime Minister but also of a series of proposals, recommendations which have been made and thus far not acted on how the pace of vaccinating Indian citizens can be speeded up by involving industry. That's what we'll be looking at on Left, Right and Centre this evening. We've got some fantastic panelists who are joining us. Mr. TV Narendran, the President-designate of CII with us, Dr. Naresh Trehan and Dr. Naushad Forbes as well. But first, what exactly are some of the key proposals which have been made by industry, and why is it important at this juncture to get industry to help all of us to increase the number of citizens who've been given their COVID vaccination? Well, India's overall vaccination numbers may be impressive, but as a percentage of the total population that needs to be inoculated against COVID-19, it's still minuscule, which begs the question, why isn't the private sector involved? In fact, NDTV has learned that the private sector is very keen to be involved. In a January 14th letter to the Prime Minister, Uday Kotak, as President of CII, wrote, hospitals should be allowed to vaccinate critical patients and paying clients eventually for ensuring that the vaccine reaches all in the shortest possible time period while not diverting resources from the government strategy of beneficiaries. He wrote, the CII suggests that for ensuring faster rollout and also to provide confidence to workers at the workplace, business enterprises could be permitted to vaccinate their employees as well as assist in the rollout for surrounding communities. The CII estimates that the involvement of the private sector will result in the inoculation of an additional 10 crore workers in the formal sector, and also local communities could have access to the vaccine. Now, if such a program were to work out, it would help, the CII believes, workers to be more productive, consumers to return to markets, and in restoring the economy as a whole. What's more, in a series of proposals sent into the government, the CII has said that there is a need to cover the remaining 80% of citizens really quickly, and that India must consider the equitable access to vaccines of all citizens. Why? Because at the moment the government has priority groups. In other words, there should be a parity in access to the vaccines, because India, the CII says in its proposals, is unique. Our demographics are very different from the world, which is why corporates should increasingly be involved. Calls for an equitable model and a parity in access absolutely critical. All right, so what can really be done effectively by industry to help speed up the process? And I think right off the top we should mention that this isn't independent of the government's efforts. It's meant to complement the government's efforts, as we've said in that report as well. Mr. Narendran, let me come to you first. This was a proposal, a series of proposals which was actually made in the month of January. In your discussions with the Prime Minister's office or with the Health Ministry or with the government, what has the feedback been on how and when industry, companies, the private sector can help?
Thanks, Vishnu. I think we've been engaged with the government over the last few months. We formed a task force in CII, which Dr. Guleria and I co-chair. And we've been engaging with the ministry and the officials and the NECVAC as well. And basically, the CII proposal is about being engaged during the 3 phases of vaccination that we've talked about. One is a vaccine shortage period, then the vaccine adequacy period, and the vaccine surplus period. And private sector involvement can be different in each of these phases. So in the first phase, and in all phases, basically the idea is to work with the government, support the government, so that a larger cross-section of the population can be vaccinated. So in the first phase, I think our proposal is how can we supplement the vaccination? Let the vaccines be controlled by the government, but we can supplement the government's efforts in vaccination, vaccinate the people in the priority groups, but help leverage the private sector network to do that. In the second phase, when there's enough vaccines available, of course, allow private sector to buy the vaccines and use it after the government has met its requirements. So I think these are the proposals that we've been discussing with the government. The government is obviously considering when and how to let the private sector in. They obviously have their own concerns that it should not seem that the people who need it, the priority sector, should not get, do not get what they should get. And hence they want to make sure that the people who need it get it as fast as possible, and private sector steps in at the right time. So that's a conversation going on. We are hopeful that sometime soon we will get some go ahead from the government. Let's wait and see what happens.
Dr. Forbes, are you satisfied with the reaction thus far from the government, particularly in a country where we've got an availability of stock? We are exporting very actively, and all that people are suggesting now is that even the priority groups above 50 with comorbidities, why can't industry help them first, particularly people who are willing to pay, right? Millions could be vaccinated much faster. So would you say that more needs to be done by the government in opening up?
So I think definitely more needs to be done by the government in opening up. Let me start by saying that I agree with the protocol that the government has laid down. The sequence that it's laid down, 10 million healthcare workers, 20 million frontline workers, and then 270 million people over the age of 50 or with comorbidities. That's the right protocol. That's the right sequence that we should follow. But I think to get 300 million people vaccinated is also no small task. To get 300 million people vaccinated, if you work out the numbers, in this first month, we've vaccinated 8 million people. 8 million people is the world's fastest rollout of a vaccination program. We should be very happy with that. But if we go at the rate of 8 million people, by the time we cover our entire population, I did a small back of the envelope calculation, by the time we cover our entire adult population with 2 doses, it'll take 17 years. So obviously, we need to be much, much faster in how we roll out the vaccine. That has to be our focus, and it can only happen if the private sector is fully engaged in this process. So I think entirely consistent with the protocol of going now at the next group, in the next phase, to the 270 million over 50, get the private sector involved. Get the private sector involved in a very full-fledged way. We have capacity that is being unutilized in our hospital system. Hospitals are saying that they can vaccinate 500 and 1,000 people a day. They're being given 200 vaccines every 2 days. We have an opportunity sitting with us. We have 100 million vaccines in stock with the world's largest vaccine manufacturer in the city that I live in. This is an opportunity no other country in the world has. Let's take full advantage of it.
Okay. Dr. Trehan, strictly from a medical perspective, at a time when we are now getting the first cases of the South African variant over here in India, or even the Brazilian one, in addition to 178 odd cases of the UK one, how is it time for us not to slow down but to speed up, to try and get as many people vaccinated as possible?
So there are several factors at play. The fact is that in the organization of this whole vaccination drive, it was prioritized as first the frontline workers, the medical professionals and the frontline workers. So that is phase 1 and 2. So what has happened is that there has been some hesitancy, and only about 50-60% of the people who are entitled to get vaccinated got vaccinated. That means that there was enough surplus of vaccine which was actually looked at with the first time requirement, maybe is not required as much as it did. So that is one factor to keep in mind. The other factor to keep in mind is that the elderly, especially the ones who have comorbidities of the variety that they are in a panic. They are living a mortally panic life right now. So on one hand, you say, okay, we will vaccinate you. That's fine. Your turn will come. But then you see reports that only 50-60% have been vaccinated. And then more importantly, the manufacturers are saying, we've got lots of vaccine. Now there's a disconnect somewhere. Now the issue of whether private sector is already participating in it, because our 6,000 employees were vaccinated by the government agencies bringing in the vaccines and being used for the injections. Yes. So that whole process is well greased now. Everybody knows how to manage the whole process, so the glitches are not there. Okay, so we have done that trial run, but now we are running into the second month. So one thing we must confirm is where is the availability of vaccine, because there are varying information you get.
Yep.
You get that the industry is saying that we got lots of them and they will expire in April. On the other hand, they're saying that we don't have the vaccine to actually go forward.
No, in
and
fact,
multiply.
I've checked this. The Serum Institute does have vaccines. They can step up their rate of manufacture, which is a whopping 5,000 doses every single minute. So supply, and it can be supplied wherever it is required. And there are other vaccines also which are coming into the market very soon. Sputnik has very
correct. So the government stand right now.
So why not just give it to hospitals and doctors or whoever the proper people are, so that people above 50 with comorbidities, again, just keeping on saying this, elderly people, you know, can get it. Because as you said, Dr. Trehan, there are senior citizens among others who are worried. They want their injection, they'll pay money for it.
I cannot agree with you more, because like I said, we are getting calls at least all day. The phone is ringing off the hook because of the fact that people are in a panic. Now, we have also made a representation to the government that, look, it should be regulated by the government. The pricing should be regulated, and what anybody who's going to inject can charge also regulated, like we did in the testing phase.
Right.
So first they started with slowly, and then as the private sector came in, we could test lakhs and lakhs and lakhs of people a day.
All right.
So the point right now is that we are at that inflection point that we should release, get a realistic view, fix the price of the vaccine, fix the price of the delivery, and let's move forward. That's our request also.
Okay, one second, Dr. Trehan.
I have today written to the Health Ministry today only to say we are ready. We will accept it will be totally under the control of the government. We will accept the pricing, but the capacity is available. If you can make it possible, let's give succor to those people who are mortally scared, because there is a very real fear that another wave will come.
No, absolutely.
There are some indicators.
Yeah, no,
now,
so one second, Dr. Trehan, I'll come back to you in a moment. I want to, let's bring up that graphic, because Dr. Forbes was, in a sense, talking about these calculations, and we have an image of that. So if we could just bring up that graphic on where India presently stands in terms of percentages. Let's bring that graphic up if we can. We'll have that up in a moment. Now, now let's have that up full screen, because I want to read from this and get Mr. Narendran to actually look at it. You know, India's overall numbers are very impressive. Lakhs of people have been vaccinated, absolutely correct. The pace of the rollout, quite impressive, absolutely correct. But let's look at it from a more realistic standpoint of the percentage of our population which has been vaccinated. Now, world over, only 2.26% of the global population has been vaccinated. This is our World in Data, which has provided this information. Israel, and just look at how remarkable they are. Yes, it's a tiny country, but they have vaccinated 74.5% of their population. There is a there's a huge decrease in COVID cases over there, which have been reported. The United Arab Emirates, the United Kingdom, which population-wise is quite a large country, but they're at 23.3%. Now, India, among the largest countries, the most populous nations in the world, the second most populous, we are at what, 0.6% of the population that needs to be vaccinated has been vaccinated, and that is abysmally low at this stage. So, Mr. Narendran, is there a sense that, you know, the government may be looking at the wrong numbers? The absolute numbers are great, they're staggering, but the numbers in percentage terms are still minuscule.
Yeah, that's true. I mean, in a large country, the percentages will always show up small. I think that's why the private sector is saying that this is a national emergency. I think we are happy to be there to support, do it responsibly, do it under the oversight of the government. As Dr. Trehan said, it's about making sure that under the oversight of the government, the rules laid down by the government, how can the private sector supplement it? Because today the bottleneck is vaccination. Bottleneck is not the vaccines. The vaccines seem to be there. We thought the vaccines would be the bottleneck, but it looks like the vaccines are not the bottleneck just now. So how can we help in that delivery? And I think the capability is there. There are concerns on the pricing, etc. The price can be controlled by the government, at least till such time that there is a comfort that people who need the priority get it. So I think there is an opportunity to work with the government, supplement the efforts of the government so that a larger cross-section can get vaccinated sooner. And as you said, over the next few weeks, I think there will be more vaccines available. And so this is just about how can we work together for the next few weeks and help a large cross-section of the population and get the numbers much higher than it is today.
You know, Dr. Forbes, what strikes a lot of us who've been tracking this closely is that if the government wanted to allow the private sector to start inoculating people, administering the vaccine to people, this could happen within days. You wouldn't have to have necessarily several weeks. The system is in place. Doctors and hospitals are in place. The vaccines can be in place within the day, and this can start instantly. So what are we waiting for? Is that not the biggest frustration? That we keep talking about this. We have the supplies, we have the doctors, we have the goodwill. Price can be decided within a day, and you know, I mean, and these can be rolled out. So why do we keep talking? Is that not the biggest concern? It's a life-threatening situation.
So Vishnu, you know, I think not just all three of us, but all four of us are entirely in agreement on what we need to do and what we must do as a country right away. So I think, you know, you'll have to rename your show Center, 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 and Center. Because we're all saying, I think, the same thing, right? Because we all think that we need to roll out the vaccination program as fast as we possibly can. The only way of doing that is to have the private sector fully involved, to do it following the government protocol. Now, let me qualify that in one way, which is that if you want to ensure that not a single wrong person gets the vaccine out of turn, not a single person gets the vaccine out of turn, then you'll have a very restrictive protocol that will need to be in place. You know, you mentioned Israel. Israel has a population of 9 million people. India has 10 million healthcare workers. Yeah. So, I mean, the order of magnitude, the scale that we're talking about is completely different. Yeah. And I think in our country and our environment, we have to accept that as long as we're operating broadly in line with the protocol, we're fine. As long as we're delivering broadly what we need to do as a country, we're fine, right? And if a few people get the vaccine out of turn, we should ignore them and get on with vaccinating the population at large. Now, you talked earlier about the private sector's involvement in vaccinating its own people, and that was, you read from the letter, and you said that's one of the CI recommendations. I think that's phase 4. So if phase 1 is healthcare workers, which we're sort of getting to now, phase 2 is frontline workers, where there's some coverage, there needs to be more. Phase 3 is these 270 million over 50 and with comorbidities. Phase 4 should be now it's open to everyone, right? And I think we can get there very quickly. I think we can aim actually to get there in 2 months. If we really apply our minds and say, let's get everyone over the age of 50 vaccinated within the next 2 months, I think it's possible to do. Only India, no other country has the vaccine stock that enables one to do that. What Naren spoke about earlier on is that when we first put this whole program together, we said, you know, the first phase is a vaccine shortage phase. India is in the tremendously fortunate position of not being in a vaccine shortage stage. We are unique in that position for a country of our size, and we should take full advantage of that.
Mr. Narendran, would you agree with that? Within 2 months, we could be in a position where other people start getting inoculated, particularly since there will be more vaccines which will be available as well. And therefore, while ensuring that there is no dearth in supply of either the medicine or of doctors for those in the priority groups, if a company says, I will administer the vaccine through my company doctors to 5,000 of the people who work over here, and all of India, across industry which you represent, gets together and does it, then, you know, it would be more equitable. CII has spoken about an equitable distribution of the vaccine without compromising senior citizens, comorbidities, all of them. Is that not something that we really need to be doing?
We need to, but I think there are a couple of practical things that we need to address. One is, obviously, all of us need to get registered on the CoWIN app, right? Because eventually you need to be part of the systems so that tomorrow if you want to travel and you need a certificate that you've been vaccinated, you get that. So we need to scale up that app if it is not yet ready to scale up. I mean, we need to look at that practicality. The second part is, of course, to make sure that the people who are on the priority list don't get missed. So it's not as if you want to vaccinate your employees and leave out the people who are over 50 or people who need that vaccine more than somebody who's younger and healthier. So these are things that we need to certainly address as we go about rolling it out.
Dr. Trehan, I just have about 2 minutes left. A brief question on the larger medical issue. Even in the first phase of what the government is doing now, healthcare workers who we would assume would be the most careful are missing the time allotted to them for their second dose. Now, this is callousness, and even though it may not impact them because the vaccine effectiveness apparently even goes up after a few days, it's just part of a system where we've got one injection, I will not come back on time for the second. Across our country, if we broaden this and people don't follow rules, then we've had it.
No, Vishnu, you must understand, a large proportion of the workers, the healthcare workers, have tested positive antibodies. Many of them, or a lot of them, have already gotten COVID overtly. So they are saying, and they are young. You must understand that most of the healthcare workers are young. And they say, if we have had COVID, and I have the antibodies, and we're also seeing after the first dose, their antibodies skyrocket. So they're asking, do we need another dose or do we need the first dose? So the questions they have, those workers who are questioning because they've already got it, is legitimate. We need to really, from this whole discussion, what comes out, and Mr. Forbes, Dr. Forbes said it very clearly, it's all center, center, center. We are all agreeing. Can anybody with certainty validate that, yes, there is enough stock of vaccine available today? Because we are being told again and again that's all false. News media reports are not correct. So only the Poonawallas can tell you exactly. I tried to put a call into him today. I have not heard from him yet. But that's the question I want to ask. Let somebody certify that, yes, we have the vaccine. Then the government will also have the comfort to say, yes, that we can now open it up. The centers are well, in the sense the protocols in the centers have been well practiced. There has not been one fatality. And by the way, as I told you, it's our hospitals. So now it is only stands to reason that if all these boxes are ticked, and the boxes, most of them have been ticked, the only thing two left are availability of vaccine and the cost at which it should be delivered and who should pay for it. So the industry is saying we will be happy to pay for our own workers. CSR can be used. So there are many, many weapons available. My biggest concern is if there is a resurgence and we have missed the bus, it will be a big backlash. We should not let this opportunity go. We are winning. We have the tools now to make it even better and secure our country. We should not miss this opportunity. But like I said, please somebody confirm that the vaccine is available in quantities that the government requires.
No, and absolutely, and there should be a statement. But I did make this inquiry and I was told that over and above the export commitments of India, for which there is an allotment of Covishield, there is an ability to ramp up production much more than what exists presently, and there is an existing stock as well which could be given across the country should there be an order which is placed to receive them.
Vishnu,
that is the situation as of this morning.
Vishnu, you can do a big service. Don't say hearsay, I heard. That doesn't work. Get it in writing that yes, it is available.
Absolutely.
You can show it on your TV, on your channel.
Absolutely. We will endeavor to try to do that. I'd like to thank you all very much for being with us. Running out of time at this program, but this is something we'll keep following. The need to involve the private sector in administering the COVID vaccine across the country.